Welcome, everyone. I'm Dr. Stephen Lindner. This is Bio 204, Anatomy and Physiology 2. So welcome to the class. This is an asynchronous online course. I happen to love online education. I've been teaching online for 11 or 12 years. I was the first full-time online instructor within the United States. I've been blessed to be part of a university that has had an online program since the mid to late 90s, believe it or not, when it was dial-up. I mean, very slow. But nonetheless, I run a master's program at the graduate level at the University of Bridgeport. And I teach at other universities as well. I've been at the Adelphi University for over 11 years, teaching anatomy and physiology, as well as pathophysiology, also online. I teach at Nassau Community College, Anatomy and Physiology 1 and Anatomy and Physiology 2. I've been there over 12 or 13 years. And I teach online at Kaiser University, which is in Florida, and they are one of the biggest educational centers in terms of medical education in the state of Florida, but I do it remotely online. Again, Anatomy 1 and Anatomy 2, lecture lab. So one of the beauties, so just a little bit about me. So besides my many years in education, I've actually been in education for over 25 years. My primary training is a doctor of chiropractic as well as a clinical nutritionist. I have had my own practice for the last 26 years and absolutely love it, love taking care of and treating patients, but I also love human anatomy and physiology and passing forward or paying forward all the information and knowledge I have about human structure and function. One of the gifts that I have is the talent of trying to take complex information and simplifying it and making it relevant. I just don't read from a textbook. It's not my style. I try and take the information. I don't want to say dummy it down because, I don't want to kind of minimize it, but I try and just make it very practical, very simple, and easy to follow. It's my philosophy and my approach when working with my patients. I never want any of my patients to feel like anything I said went over their head and they just couldn't understand or follow me. And I apply that same approach with my students. I want to make sure that my students get above and beyond what their expectation was. That's my philosophy when I take care of patients. I want to exceed their expectation, but that same philosophy rolls over into education. What I expect of my students is really just to do their very, very best. Not your best, your very, very best. That requires putting time and effort, not finding time, making the time to make your work a priority. That's how I raise my children as well. So I'm a healthcare provider, I'm an educator, I'm a father, I have 3 wonderful children, and what else can I say? I love fitness, I love exercise. I've been into exercise and fitness, health and wellness since I was about 14 years of age, and still follow through with all of that, and it fits the lifestyle of a healthcare provider. So when my patients come to me, they look at me and say, he resonates as a healthy individual. I'm going to take the advice from him. When my students learn from me, I think it's important that students know who they're learning from, who are they taking information from. So I'm currently still active in practice. I currently my head is always in the books. I'm always learning, always reading, always current with research and everything that's peer reviewed. And so that's a little bit about me. I want you to have a very pleasant experience with me in my course. And I hope you enjoy my lectures. please make the time to watch all of my videos and not just PowerPoints. Just don't look at the PowerPoint. Students miss lots of information. Always look at my exam reviews. And if you have any questions along the way, feel free to email me, and we can always set up a Zoom if you have any challenges or issues. But my video reviews are pretty clear, very thorough and detailed. Always take notes. Always write and take notes. Don't just look at PowerPoints and study them. The brain can absorb so much more if you use the notes as a guide, but write things out. It's part of that neuromuscular reflex. When you're typing things, the letter J and the letter K feel the same on the keyboard, but when you write, right, you listen, which is learning. Now you're visually seeing things, that's learning. Second time, and then you're reading your own writing, which is the third time. It's kind of reinforcement. Repetition works, and repetition works. All right, everyone, I will create a separate video that goes over the flow of the course and gives you a tour of the course.